Welcome to the German Climate Pavilion at COP28 in Dubai. Ambitious, just together.
Good evening, everybody, and welcome. Probably one of the final events of the first ever Health Day at COP, which I'm really proud of, and I can't stop repeating it enough after waiting that long to see this day. But welcome to this panel on climate resilient health systems, delivering on the promise to leave no child behind. So I'm Dr. Revati Falke. I'm the Global Director for Health Nutrition at Save the Children International, and it is my immense pleasure to welcome you all at the end of the day to be here. And most importantly, I would like to thank the panel, because I know that most of you had multiple speaking assignments today, and I see that you are still fresh and willing to do this. So I'm an optimist, so I just learned that in the previous panel that, you know, optimism always takes over. So thank you. I won't repeat a lot in terms of how the impacts of climate change are affecting human lives and environmental systems, but I think there is general acknowledgement that the impacts of climate change are here, they're here to stay, and projected to rise. And of course, we have quantitative assessments of how health is going to be affected, the range of health outcomes that will be affected by the range of environmental exposures that populations are exposed to, and multiple times. So the cumulative impacts of that as well. Air pollution, the impacts on nutritional security through how food systems are being impacted by climate change, so on and so forth. The numbers for stunting, wasting, micronutrient deficiencies are appalling, and the projections are even more disappointing in terms of how we're going to be able to deal with such numbers. Now, death is just one outcome, or mortality is just one outcome that we do tend to focus on, but the burdens from the diseases is going to come more from morbidity, and I think that is the key thing that we should be watching. Access to services, even with the current burdens of disease that we see, is a big challenge for global health. Many countries are far behind the SDG goals, whether it is achievement of UHC, whether it is the goals that have been agreed under UHC. Many countries are falling short. On many of those indicators, progress has either been stalled or reversed. And so just managing the current burden of health impacts is becoming a big problem. About half of the world's population does not have access to essential health services. 44% of the world's population is without a scheme for health protection. So these are the two basic principles of UHC, and we are failing quite badly on them. Health systems themselves are at the forefront of the climate and health crisis, but currently they are not equipped to manage these changing health risks. 25% of the global healthcare facilities lack basic water services. About 1 billion people in the world are served by healthcare facilities without reliable electricity supply. And only half of the hospitals in sub-Saharan Africa have reliable access to electricity. So obviously this is also transforming into or contributing to the excess mortality that we are seeing. They are also vulnerable to the physical impacts of extreme weather that we see. So they do have a unique challenge of having to raise their ambitions for achieving UHC and universal health coverage, but at the same time keeping their own emissions down. And I think this scaling it up but keeping the emissions down is probably the biggest challenge, and that basically justifies why we've heard this climate resilient and sustainable health systems discussions for a very almost 2 years now that we are focusing on climate resilient health systems. So that's the reason why we are here. In this panel, we will discuss what the WHO is, how much of progress has been made on the WHO Attach program, and Elena is going to talk to us about that. But we're also going to discuss the role of the different stakeholders. So governments, academic and research institutions, civil society organizations like ours, Save the Children, donor countries and multilaterals in what does it take to build resilience within health systems, climate resilient within health systems, but also identify the opportunities that are available to us to have collaborations to push this agenda forward together. So I have the pleasure of introducing the panel to all of you. Many of these people actually don't need an introduction, but I will give you their highlights. So it's my pleasure to introduce Inga Hashing. She's the CEO of Save the Children International, the organization I represent here as well. The world's largest independent organization working to ensure every child survives, learns, and is protected. She has been associated with Save the Children for more than 25 years, first serving as a youth advocate herself, and later on boards of Save the Children country and member offices. Welcome, Inga. It's a pleasure to have you here. Then we have Elena Villalobos-Prats. She's a senior technical advisor for climate change and health at the WHO headquarters. She leads the WHO Attach program and is responsible for capacity development and country support for climate and health. Thank you, Elena, for joining us. I know that you're very busy. You are between the ministerial and the high-level reception, so thank you for taking the time to come and speak to us. We are still waiting for Professor Ibai, Chris Ibai. I hope she walks in any minute, probably lost in the maze. She's a professor at the Center for Health and Global Environment in the School of Public Health at the University of Washington. And she's also one of the people who had quite an important role in the IPCC reports, several of them, risk assessments in the US, and also the 1.5 degree report that came out a couple of years ago. Somebody very dear to me, Dr. Yusuf Nassef. He's the Climate Adaptation Director at UNFCCC, so you can imagine how busy this man has been over the last 2 days, building up until the 27th COP that people are pledging the monies that they have pledged in the last 2 days for adaptation, prioritization of adaptation. Dr. Nassef has led the adaptation work streams under the UNFCCC pretty much since its inception. He brings over 34 years of experience in diplomacy, international environmental policy. He has led the UNFCCC inception and support for the national adaptation programs of action, the national adaptation plans, the Nairobi Work Program, an international knowledge hub for impacts, vulnerability, and adaptation, and also the Warsaw International Mechanism for Loss and Damages. So thank you, Dr. Nassef, for taking the time to be with us. I also have the pleasure of introducing Dr. Phonphas Soet, the Director General for the Department of Health and Hygiene Promotion at the Ministry of Health, Lao PDR. He's a dedicated health professional who has spent more than 34 years working in the Lao health system, serving the public in various positions. And thank you for being here. I think you give us reason to be proud in many ways with holding the first ever health-focused GCF proposal in the world. So thank you, really, and really congratulations to the team for making that happen. Then we have Morionch Sarakayao. She's the Chief Resource Mobilization and Growth Officer from Gavi, the vaccine initiative. Her leadership has been instrumental in driving Gavi's strategic growth and raising critical resources to provide equal access to vaccines for all. Most recently, she has provided leadership and direction to COVAX as a global initiative trying to achieve equitable access to the COVID-19 vaccines. Thank you, Morionch, for being here. Then we have Professor Dr. Anna Katerina Honich. She's the director of the German Institute for Development and Sustainability at ADIOS, which many of you will know. And she's also the professor for global sustainable development. Ms. Honich serves as an expert advisor at the national EU and UN levels. Thank you very much for being here. We have a final speaker who will be joining us a little bit late, Dirk Meyer, who is the head of Directorate General 4, Multilateral Development Policy Transformation Climate at the German Federal Ministry for Economic Cooperation and Development, BMZ, as many of us would know. So with that, I think I will hand over to Inga to give us the opening remarks.
Thank Thank you so much. Yes, now it's working. So thank you so much for that warm introduction, Revati, and it's great to be on this panel at the end of the day, but it is a very, very important topic, so I'm looking forward to hear from all of you. But before we hear from my colleagues on the panel, I really want to make sure that we are putting this in the perspective of what this means for children. Because as Save the Children, that is our mission, to ensure that children's rights are being upheld. So therefore I want you to also, before we go into the more technical components of the conversation, to have that front of mind. And I want to start by giving you an example, and I don't need to go into the numbers of the challenges, because Revati, you shared that with us in the opening of this session. So I want to share with you what it can look and feel like for children themselves. A month ago, I was in Peru, and I had the privilege to talk to a girl, 11 years old. Her name is Valentina. And she shared with me that her family, they didn't have the resources to buy proper food, which meant that they went to bed, she and her siblings, they went to bed hungry almost every day. They didn't have money to buy enough food, they didn't have money to buy nutritious food, vegetables, fruit, the things that we all know that you need to have a balanced diet. And when I spoke to her, I asked her, so not being able to eat properly, what does that mean for you? How does that make you feel? How does it impact your life? She was sharing with me that she often had challenges keeping up with school because she couldn't concentrate. She couldn't concentrate on what the teachers were saying. She couldn't concentrate on her schoolwork. She often felt weak and that she wasn't the best version of herself. When I met Valentina, she had been part of a nutrition program for a while, which also meant that she could compare what it meant getting one nutritious meal a day with not getting nutritious food. And this had completely transformed her life, the life of her family. I also spoke to her mother that told me that being part of this program didn't only mean that her kids could eat, but she also, as a mother, had been given resources, skills to know what to do with limited means and cook more nutritious food. So for Valentina and her family, that's good. But it's really important to as important as programs like this are, they are not addressing the root causes. And without system changes, without sustainable system changes, we will never be able to address the root causes, and we will always have to initiate and run programs like the one that we are running in Peru. I'm very proud of that program, but that's not a sustainable solution. So we need combined direct interventions for children in need with sustainable system changes. And also for Valentina, I mean, when I spoke to her and her mother, they live in a community very impacted by inequality and discrimination. And knowing that any day dramatic changes and shifts in climate can completely disrupt their life. Their houses could be destroyed. I mean, so there's no safe space. Even if she can eat and concentrate better in school, she's still worried about her future, and that is what we need to change. And you all know that this is just one example. Valentina's story is not unique at all. You have millions and millions of children like this in so many countries around the world. And as Save the Children, one of the things that we are saying at COP, and we are trying to say it in every single conversation, and that is that the climate crisis is a child rights crisis. Children have done the least to create the problem that we are now facing, but they are impacted the most, simply because they are children. They are as we all know, being a child means that you are more vulnerable to threats and impact. And I think it's really important to understand, which you all know who are in this room, that for a child, the implications of climate change has also dramatically changed in the last 10, 15 years and beyond. And as Save the Children, of course, we are trying to make sure that we have proper data to say, okay, what is the difference of being a child today compared to what it was to be a child when some of us were born or our parents were born. And we know that a child born in 2020 will experience almost 7 times more heat waves in their lives compared to someone born in 1960. So in 60 years, that means 7 times more heat waves. And you can look at every single drought, flooding, it's the same. Children today will experience climate threats that we can only dream. I mean, it's a nightmares, but it's things that we could not even think about when we grew up. And Revati, you talked about how climate change, how the impact on children's life is very complex and not linear. And of course, we can say that lack of access to basic services means that when children get sick and they are more vulnerable because of the climate crisis, so they are more vulnerable to various diseases. And when they get the diseases, we don't have the health structure and systems in place due to climate change. It has physiological, but also psychological, mental health related issues. And I do think it's really important to understand that for many children, it will define the rest of their lives. If they are able to grow up in an environment where they are not always having to fear being victims of the next climate crisis, or if we can actually build sustainable and resilient structures. As a child rights organization, we do talk about the climate crisis as a child rights crisis, but most importantly, we also talk to children themselves and ask them what they think. And we did the biggest ever consultation last year that we've done as an organization when we talked to over 54,000 children in 41 countries. And we asked them what they cared about and what they were worried about. And without, I mean, in every single country, access to health services was mentioned, access to free and equitable health services, because in many of the countries where these children live, even if health services are available, they simply can't afford them. And also leading up to COP, we have done simulations where groups of children have been able to meet their representatives talking about what are the key messages that they want their governments to take to COP. And they also ask for health services to be protected at all costs and free healthcare to be provided to children affected by natural disasters. They ask decision makers to address mental health challenges arising from floods and droughts, and also recognizing the stress imposed on communities due to climate-related events. I was in Pakistan in August, and as you know, that was a year after the major flooding that affected affected the whole country, but where more than 1/3 of the country was underwater. And talking to some of these children, still 1 year later, they are living in tents. They struggle to put food on the table, or their parents are struggling to put food on the table. And they are so resilient, which is incredibly encouraging to see. But if we fail them, they will have no future. And we really need to ensure that children can actually dream about a future and can create a meaningful life for themselves. So I really want to stress the importance of thinking about this as a child rights crisis and not only talking about it in theoretical terms, which is what we often do. Other people will, I'm sure, talk about the finances and funding, which is also something that we as an organization is pushing for, because we do know that one of the key challenges is that we are not putting enough funding in the climate agenda at all. When we looked at 4 key financing mechanisms, we saw climate financing mechanisms, we saw that only 2.4% went to child-related issues, and less than 1% to climate change and health-related issues. So we do have a major funding gap that we need to do something about. Revati, you mentioned the incredibly interesting and what I hope will be very successful climate and health project that we will hear more about later. And I'm very proud to say that that is a collaboration between Laos, WHO and Save the Children. So we're very much looking forward to that as an example. I just want to leave you with that those of us here today are here because we care deeply about this question. We are part of the positive change. And I think we all need to remember that if we are not acting, and acting even more and more forcefully than we do today, we will fail the children today and the future generations of children. So for them, we need to act, and we need to act now. Thank you.
Thank you, Inge, for setting the tone of this conversation, that putting the most vulnerable at the center of the discussions, even if we talk about climate resilience within health system, and also the systems level thinking, whether it's vulnerability assessments, whether it's design of interventions, whether it's evaluation of interventions, taking that systems-based approach for managing the risks and responding to the health impacts, and of course the inequality aspect. So thank you, Inge, for setting the tone for the panel. I would like to now move on to Elena. Elena, if you could please tell us about the Attach program and where we are with it and where are we going from here.
Thank you very much, Rebati. Basically, we are all today here watching this incredible, successful event where health is everywhere. It's been a long way. It took us 28 COPs to come here. And I think looking in retrospective, everything started to change in COP26. So basically, it was thanks to the UK as president of COP26 that two important initiatives were launched related to building climate resilient and low carbon sustainable health systems. At that time, a total of approximately 50 countries committed to these initiatives at Minister of Health level. So basically, building on that success, we launched the Alliance for Transformative Action on Climate and Health in June 2022. And then basically the legacy that the UK started promoting health was followed by Egypt. So Egypt, as president of COP27, they basically joined the Attach as one of the co-conveners, but they also launched a very important initiative with the ICANN, is Nutrition and Climate Action. And now we come to the COP28 with basically, we are just impressed. So we not only have over 50 ministers of health debating right now and expressing their priorities, we have 120, I think we just got the 124 Ministry of Health endorsing the Declaration on Climate Change and Health. So basically this declaration is repackaging again their priorities and raising their voice to the overall climate change community for increased action on climate change and health. Sorry, on climate, just basically to protect the health of our populations. From the health community, I think we are all convinced that the health argument is the neutral argument that every country can understand. And if we basically reflect on all the faces of those affected, you mentioned before, just thinking in the greater horn of Africa, 31 million people are facing acute hunger and 11 million children are facing acute malnutrition. If you think about other extreme weather events, if you compound those impacts and think about flooding and this malnutrition, is basically translated in death of many thousands of kids every year. So basically, this just shows, and these are not the only impacts, of course. If I think about my country, heat stress, fires is a reality. I was born in Sevilla. I cannot even breathe there. It's 45 degrees in the summer. So basically, it is affecting all of us. And if you think that, I think COVID showed us something, is all countries are vulnerable to huge shocks like the ones we face. So basically, if you think about the health systems and how ready they need to be to just be able to respond to the shocks and stresses we are facing in terms of the health impacts from climate change, it is clear that we need to build the health systems of the future that will only be possible if they continue to provide quality of care, but they are climate resilient and reduce their own contribution to emissions. So basically, as of today, we just got the 82 commitment to the Alliance on Transformative Action on Climate and Health. We think this alliance is very important because it's leveraging the collective power of all actors prioritizing climate change and health. Stronger, I mean, together we are stronger. WHO has been fighting for a long time, and for us it's really moving to see all this support. So as you rightly mentioned, until now, less than 0.5% of finance was going to health. And we are convinced because one of the reasons is because there was not health representation within the accredited entities. So we really welcome the support and the prioritization that Save the Children, GIZ are giving now to health. We are very happy with this collaboration. We hope it will be even strengthened. And there are probably good signs that this is changing. So we have now new agencies, the World Bank announcing that they want to do more in this area, the Global Fund, Gavi. So basically, the landscape is really changing. So I think that's all from my side. I'm sorry because I'm going to be very impolite. I need to leave because we have all these ministers that, yeah, we need to be there. But thank you because the change is all of us. And I just wanted to thank you all for being at this historical moment now. Thank you.
Thank you, Elena, and completely understand your commitments, but thanks for taking the time to join us. And I think Elena makes two really important points, that COP26 was 2 years ago. And at that time, it was, I remember, a big fight to even get a pavilion for health. So that was the first time we had the WHO Health Pavilion. It was, the borders were just opening, so there was a huge chaos. If you think this is chaos, that was another level. It was smaller, but there was no certainty on, what the immunization, requirements will be, what the entry, do you need a test, do you don't need a test, but we got through that. But I think that it's incredible that from 50 countries, we've come to 82 in 2 years. So we've moved quite fast in terms of advancing not just health in COPs, but also this entire conversation about climate resilience and sustainability of health systems. So I think we should all be proud to some extent, but of course we have a long way to go. So that's really good. So with that, we will move on. Of course, we took very long, 27 years to have health here, and I'm looking at Dr. Nassif. Dr. Nassif. What can be done to ensure, as Inga said, children and health and health systems are appropriately covered in the UNFCCC processes, the adaptation communications, the global goal, the global stocktake mechanisms, and of course, the loss and damages, and other processes within UNFCCC. Over to you.
Thank you, Revati. Can you all hear me? Okay. Maybe I start with a couple of notions that Inger left us with. When you mentioned Valentina wanting to be the best version of herself, I started thinking, what would the world look like if it was the best version of itself? And if it was, what would that mean for children and for children's health? And also your notion that we are part of the positive change. The reason this is all important is that the whole discourse in this COP and most discussions on climate change are about you're all going to die, you're sleepwalking towards disaster, you're whatever. It's the negative narrative, and what comes with it is just an attempt at moderating harm. So how can we undo some of this? So if you start from a bad baseline, it's just undoing harm to take you back to the bad baseline. And I think our imagination has to go a bit beyond that to see, okay, what is the landing zone, the aspirational landing zone? That's not just about removing climate hazards, but also moving the world to be more equitable, to be respectful of children's rights, and where everyone can thrive and progress. And we heard from Elena also very good positive movements here within the COP process on climate and health. Now, the negative narrative is very clear. On mitigation, the science tells us that we're supposed to reduce emissions by 43% by 2030. The promises coming from the national reports are pointing to an increase of 8.8%. So the sign is wrong to start with, let alone the number. Similarly, in adaptation to climate change, in 2016, we created a very rigorous process for adaptation planning for countries to develop all their priorities for responding to achieve resilience in the face of climate change. What we have now is just 50 countries 7 years later that have submitted their plans, which articulate their urgent and important needs, and very few of these have started implementing their needs. So the baseline isn't really great, but climate change is a process, to a large extent, a process of optimization, of trade-offs. So because of limited resources, countries have to see, okay, I give this sector or that sector, there's some winners and losers there, there's optimization across levels, national, subnational, regional, there's always some trade-offs there, across geographies, there's transboundary impacts, but the more important trade-off, I think, is across time. And that links very closely to intergenerational equity, because we often, inadvertently in most times, prioritize the present over the future. Prioritize anything that will give us benefits tomorrow over something that will give us benefits that will help our children further in time. And the way we teach economics and business and the way political systems work makes this natural. It's the right thing to do. You know, you have a short electoral cycle, you have discount rates and cost-benefit analysis. That automatically goes against intergenerational equity, and we teach it and perpetuate it. And so the children start from a baseline that's already losing. In addition, in fora such as this, they have no seat at the table. They're not part of decision making. So all other groups that may be getting the short end of that stick, at least they can have side events, they can have constituted bodies, the indigenous peoples, for example, who also have a long-term outlook, usually due to their worldview and mindset. They now have a seat at the table, at the decision-making table, as co-chairing a facilitative working group that ensures that their rights are taken into account. So that's the first thing. We don't have a way to get organizations such as Save the Children to have a stronger role in decision-making, beyond being an observer entity. Now, we've heard about the disproportionate vulnerability of children, and I think many people just lump children among all vulnerable groups and don't realize that children are not just small adults, but rather have very different levels of vulnerability that actually can create permanent harm in terms also of mental health. A colleague from the Red Cross was telling me when she was assessing the situation after Hurricane Haiyan in the Philippines, and talking to the children, which was not part of the plan, but just inadvertently happened, found the immense amount of trauma they still maintained long after the hurricane. Whenever they heard the winds, the howling of winds, it immediately created an intense sense of trauma with them. This was not happening with adults. And so I think this vicious cycle of vulnerability with children is a lot more prominent and often overlooked, including on mental health. Now, what we can do is, I think we need an audit of our work streams for child responsiveness. Being heavily involved in everything that this process is doing, from national adaptation plans to reporting requirements, NDCs, BTRs, etc., to the financial mechanism, the Nairobi Work Program, we mentioned that, even the new Loss and Damage Fund. I think all of these are lacking that child responsive component to it. It gets lost within a long list of vulnerable groups, which themselves don't even have sort of an actionable arm to the mention. The mention of these groups doesn't translate into specific action. Just appears in a sentence, especially X, Y, and Z, and that's it. And so, for example, with the national adaptation plans, we have supplements on several themes, including health, but no supplement for children. So this is a very low-hanging fruit, and we can easily get all the organizations involved in children's health and children's rights to do that. So countries will be able to follow rigorous steps on making sure that their NAPs are child responsive. In terms of the fund, the loss and damage fund, it would be important once the board starts work on setting the criteria for finance, that they make sure that it's not just an aggregate type of guidance that applies equally to everyone, but to make sure that children's rights and children's health are taken and given good priority there. Our knowledge management systems in the organization, the Nairobi Work Program, unfortunately this is something within our powers to do without more guidance, and so I promise to do that when I go home, to make sure that we are engaging a lot more the stakeholders that are more representative of children's health, because we have all the time expert group meetings, etc., that frankly lack that component totally. And that is our fault, definitely. And so the issue when you have a theme that is distributed across many items, that it never gets the priority. It might appear in 100 different decisions, but it's not enough. And so somehow virtually you have to think about it as one as one big heading that then we translate into action across the board. And this, I think, is something that could easily be captured, for example, in the outcome of the global stocktake as we move that forward, or in the global goal on adaptation, if a country would submit a sentence to that end. As of now, I looked at all the submissions from the global goal on adaptation that came today for the text that will come up at midnight, and I do not recall seeing any mention of children there. So I think it is incumbent on us to make sure that the parties hear the need for this type of thing and translate it into reflecting these types of provisions in the text that then becomes international law eventually. There's a very clear sequence of how this happens, and if you don't get the first step right, then nothing will happen except that we keep talking without an outcome. So I think there's a lot of hope. There's momentum that's emerging, and we just need that little nudge to bring it closer to the policy process and the mandatory actionable provisions that come out of this COP. And I'm sure we all want that, and I can certainly help from my side. Thank you very much, Revati.
Thank you, Dr. Nassif, and thank you for giving us clear, actionable directives on, how organizations like Save the Children can partner within the UNFCCC processes. And I particularly like your point about tokenistic mention, and that's exactly what happened even in the ministerial declaration. We pushed and pushed and pushed through member states for what language should go in, but it was exactly as you said, the line, vulnerable groups, including, but we made children, we got the word children in there thanks to Germany. And then very kind of, I would like to say that this is also something take home for us, Inga, that, how do we convene all the organizations that we work with and lobby and to kind of, get that moving forward as we go. This is a nice segue into the importance that member states and countries play in delivering the ambition that we set for climate and health action. So moving over to Dr. von Versoort, please, could you give us insights from the first ever health project under the GCF grants portfolio on climate and climate resilient health systems?
Hello. Good evening. My name is Pon Pasert from Lao PDR. I work at the Ministry of Health. I am very proud today because it's the first time for me to join big meeting like this. People in the world have a promise together how to protect the world, how to protect the health, and how to protect the environment for the children in the future. So today I would like to share our experience from Lao PDR Lao PDR has long recognized the impact of climate change on our population and development. We know it increases inequity both now and in the future. Health facility and community in Lao PDR are vulnerable to climate change, including more frequent and intense flood and drought, and increasing incidence of heat wave. In 2017, my Department of Hygiene and Health Promotion created a strategy on climate change and health adaptation. The strategy overarching vision was to ensure people are healthy and strong. We knew we need to create a stronger, more resilient health system with the capacity on track, plan for and respond to climate hazard and change in risk to health. And we knew we need to do this scale to have a real sustainable impact on the system. In October 2023, we became the first country in the world to be obtained funding from the GCF, Green Climate Fund, for a fully health forecast project. Together with the WHO and Save Children, we created a project that will intensive support 100 health facilities and 200 communities over the next 5 years. It will reach over 1.8 million people living in highly climate vulnerable rural area. This is almost 27% of the population. With a value of $28 million, this project will enable us to drastically speed up our shift to more climate resilient health system. Doctors, nurses, and community members will have the knowledge, tools, and resources they need to continue to face the impact of climate change. This project is expected to serve as a model for scaling up climate resilient health service in Laos and other vulnerable low and middle income countries in the region and beyond. Why we celebrate this success? We know that just this one project is not enough, but we are working with various partners both in the German government in Laos and international to ensure that we meet the goal under the National Health Adaptation Plan. And we hope that all of the partners can work together for protect the health and protect the environment. Thank you so much. Yes.
Thank you so much, Dr. Ponfasert, for really sharing the insights of, as you said, you are proud, but you've also made us very proud, all of us. And very important point that one project is not going to be enough, right? Not enough for health, not enough for managing the impacts. So absolutely important point there that we need to do more. We need to do more jointly, and we need to do more things beyond health as well in the health determining sectors. Thank you very much. That brings me to our next speaker, Marionche Sarakayao. Please, what is the role of multilaterals in health system strengthening and achieving scale for UHC? We just heard from Inga that 5 multilaterals over the last 20 years, child responsive financing, 2.4%. So, please.
Vaccines to children, and that's really our primary focus over the past 20 years. And what I would say first to Inge is that I think we have not done that bad over 20 years. We have helped immunize 1 billion children, and also save 17 million lives, and also, of course, much more also when we look at how routine immunization helps connect 90% of the world's children to the whole network of health interventions, particularly in the first year of their life, and also bringing then their parents, the families in contact and being able to be checked. So it's a very important, of course, way of being able to look at children and give them the opportunity to grow. And I really like what my neighbor said, because I think we do have to look at these issues also in a very optimistic way. And I think that's what I like about the work at Gavi, is indeed pointing to what can be done, not just the difficult parts. So what I've said is that we can do a lot. We have already, thanks to many people in this room, a lot of the partners here, put children on the right path to growth. But it's true that with, and a lot of the panelists have talked about it, with the growing, of course, impact of climate change, this may be put in jeopardy, right? And particularly, I think I will quote a few things. Of course, the growth of a vector-borne diseases that are very climate sensitive and actually happen also to be quite deadly for children. We know that some of the biggest causes of child death is like malaria, obviously, and that's obviously a disease that is very, climate sensitive. So you have this growth of vector-borne disease. Of course, a few of you have alluded also to the damages that can happen to health facilities when we have these extreme weather shocks. Just to name a few, and then of course the whole migration that ensue. What we have counted, we have seen at Gavi, and we are estimating, is that potentially with these effects, you can have an increase in what we call the zero-dose children, the children that have not had access to any vaccine, and these are actually the children that are most likely to be more vulnerable, to be affected by malnutrition, but also, we're just coming out of a pandemic, that are more, prone to be, to have that increased infection. So of course now we are very keen to tackle this, and we really see as an imperative to have investments in climate, in adaptation and mitigation for this. So the first thing I will say that in the spirit of my neighbor that is positive is that, we do have vaccines for a whole list of climate sensitive disease. We have a portfolio of vaccine for 6 diseases. I will start with, as I said, the deadliest one, malaria. Now we have a malaria vaccine. We now have 2 vaccines. We actually probably heard the news last week. We actually starting rolling out the vaccines. Of course, it has to be done in complementarity with other health intervention, but that's very positive. So we have actually to cheer, and indeed what's important is be able to have the financing to roll this out as fast as possible, because and to have enough supply. We've seen what it can do when we don't have enough supply, so we are really also encouraging local and regional manufacturing for this to happen. We have vaccines for yellow fever, cholera, Japanese encephalitis, typhoid. So I think we have to cheer up, but really push so that, because these are measures that exist and we shouldn't forget. And as, and that's something very important that can already protect children's life. We do have a lot of work in integration with a lot of the nutrition also initiatives, so that, we can offer this intervention at the same time of other interventions. So that's very important. And so I think we are indeed ready to, as multilateral, to do much more about it and partner. I had today, I met, of course, today the Green Climate Fund head and other organizations. I think what's very important here, to your point, is we have also to be very mindful to have the right principles to encourage this financing. Indeed, a lot of the financing you hear talk about today, of course, is geared more to energy, renewable, but whereas investing in health, as adaptation components, mitigation component, greening the health facilities, and we are doing this with solarization, cold chain. But so I'm really working, and want to work with the MDBs to really have the right principles of financing, because that's what will unlock the financing that Inge is talking about. So just to say that we are really ready to join forces with you and count us as a partner to do more. Thank you.
Thank you so much, Marie-Ange, and likewise, please count us in all the climate things you discuss. I particularly like 2 points of yours, saying that we are playing catch-up in many ways, right? So getting the scale, getting the speed in line with how the burdens are evolving and maintaining that flexibility, right? And then also the integrated programming argument that, this is something that we have pushed since Alma Ata, that are we really putting, in your case, immunization at the center of nutritional and health programs, and how can we as people delivering these services incorporate some of these things? And the other thing that you mentioned was the financing principles. And I know that this week, 41 organizations have signed up to the financing principles for climate and health, so which is a start, right? So of course, probably at next COP, we have many, many more organizations aligning and following these financing principles. So thank you very much. That brings me to Professor Dr. Anna-Katrina Honich. Professor Honich, you have co-authored the flagship report on healthy living on Healthy Planet by the German Advisory Council on Global Change. Could you give us some insights of the key governance processes that are ahead of us and important outcomes of your work?
Yeah, thanks. Thanks for having me. And I realize it's warm in here and it's already getting quite late. So let me bring 3 points to the tables, so to say. But I start with point 0, if I may, and that's just to mention a statistical or a publication that came out from the Federal Office of Statistics in Germany that showed to us that if you are born as a child in poverty in Germany today, or 2 years ago that was, so 21, your likeliness to remain in poverty is by now double as high than 30 years ago, so 1990. That's the statistically based assessment. So I'm mentioning it here in order to sort of basically point us and remind us of course, the Agenda 2030 and its one core principle of universality, that these challenges and saving the children being a universal challenge are indeed universal. But let me take it from there and bring the G20 and the G7 as 2 governance forums here into the discussion. Why do I do that? Simply because the presidencies have just been passed on or are being passed on as basically as we speak, or with the at the end of December, basically from India has already passed on its G20 presidency to Brazil, and Japan is passing it on the G7 presidency to Italy. And Brazil has issued already its main areas or focal areas that it will put an emphasis on. And the first one is social inclusion and the fight against hunger, which of course are immensely linking or immediately linking to the health topic. Now, health in itself is at the moment not yet mentioned. And that's why I partly mention it, because I think it's now, I mean, we know, the institute I'm heading has been over quite a few years now, always either leading or contributing to the advisory processes of G20 and G7. So now it's exactly the time where basically a topic such as health and also a children-oriented health angle can be carried into these presidential programs. And as we also know from the government negotiations with President Lula on bilateral matters between Brazil and Germany, this topic of social inclusion and the fight against hunger is a very important topic to him, and he does, not in the written down content, but if you follow the discussions, it is actually linked in the Brazilian context also to universal health coverage. Traditionally, also to mention, the G7 plays the role within the interplay of G7 and G20 to, push for its own agenda in some respect, but also carry finances into the discussions. And under the still ongoing year, Japan had put an emphasis on universal health coverage. So, of course, the question is now how to carry it into an Italian presidency that has not published its focal areas yet. My second point is I want to point us to health literacy and the reflection on education for healthy living on a healthy planet. Here I'm referring to this flagship report where we have a particular section on education. I won't go much into detail. I just want to mention the relevance of course, carrying in a way one health-oriented or planetary health-oriented teaching into the curricula and in the school context, in the formal educational context, but of course go beyond. We all remember the situation during the COVID pandemic where the washing of our hands and the keeping a social distance became sort of ground rules, and where we in the beginning saw that those countries that had quite some experience with, for instance, SARS in the Southeast Asian context or Ebola in the West African context, societies were very quick in taking these on. Maybe my colleagues can add. Were quick care than many societies also in the European context or in the North American context, simply because of One Health or planetary health literacy within the societies. No? And we just did actually a survey in the Kenyan context, the Kenyan context around topics of WASH, basically, or questions of WASH. And interestingly, of the 375 households, not a single one considered it a potential health risk to live in close proximity with animals, with livestock. It was very interesting to me to see that. No? And I come to my last point and want to weave the discussion a little back to the question of which role could health or should health and one health-related parameters play in climate policy making. No? Now, Nassef already mentioned, I think you mentioned, we might need to look at or audit our work streams. You pointed also to the national adaptation plans. We did an assessment in preparation of this COP where we looked at the relevance or how much over the past 8 years, since 2015, basically, which type of role do indicators that aim for the reduction of gender inequalities and social inequalities, so basically SDG 6 and 10, 6 is incorrect, sorry, 3 and 10, feature in nationally determined contributions. And we can see quite an increase. We unfortunately did not do this for health. No? So I wonder how also you will reflect on that angle to basically encourage on the national levels, no? The reflections on how to carry health, and best would be One Health related parameters into the nationally determined contributions. And my last point here, when we reflect on the ongoing finance discussions, no, with regard to how to battle the debt crisis unfolding in many countries of the world, and how to usually then also mobilize private funds. I mean, that's an ongoing challenge. We hear the propositions regularly to think about debt for climate swaps. Another proposition within the UN context runs debt for SDG swaps. Now, if that is an instrument to be carried further, that of course would enable a stronger linking of climate-related and potentially health or social inequalities and food securities into the finance debate. Thanks.
Thank you so much. And yeah, and two critical points like that. Where are our opportunities to influence existing kind of governance structures, and also the capacity strengthening component, right? That is also a very critical one at multiple levels in terms of understanding where our opportunities for interventions are. So thank you very much for that. So that brings us to the final segment. I would request all of you to tell us one key message. Now you've heard each other, you've heard in terms of what key points people have raised. So what's your one message to us as we leave before we have the closing remarks from Dirk? Dr. Nassif.
Okay. I think one key message is to push for that mindset transformation from short-termism to long-termism, because that is where we falter in terms of intergenerational equity and ignoring the children and the unborn children as well. So that's one.
Sorry, what was the... No, I think the one message would be that be positive, because we do have solutions. I think it's really also thinking how the solution that exists, we can make them more climate-proof, no? And really more systematic in terms of introducing them.
Hello. For me, I think that one message, climate change is related on of the sector and on of the economic and health, so that how to work together and on of the sector to work together related with the climate change. Yes.
So I agree with everything that has been said. So to come up with a point on my own, I do think, in addition to what my colleague said, I do think that it's really important to ensure that we hear the affected people themselves, so that we do not just talk about people, but we actually listen to them. And of course, from my perspective, child participation and inviting them to the table. But yes, we do have the solutions, and we need to have a long-term perspective. And I think they are better than we are at that, so include children.
Yeah, let me go with underlining, well, we are in a situation where that is urgent, and we speak of urgency governance in this flagship report. I think it's very, and the argument is, of course, and I've heard this here between the lines before as well, that health is very dear to all of us, and carrying health and or carrying the climate, the fight of the climate crisis into a wider audience by connecting it with the health challenges, and here drawing on long-term data series, that can actually show how, I mean, every year we have 9 million deaths because of pollution patterns worldwide. That's 9 million. I mean, that's WHO data. We had 7 million dying of COVID-19. So we have the data to back up that is a fact. One sentence. Sorry, I apologize.
Say that again? Yes, of course. I was just coming to that. If there before, I know that, we are quite a few. Please, Dirk, please come over. So this, Dirk, I introduced at the beginning of the panel. I don't know if there were any questions. I know we are quite exhausted, but are there any questions from the audience to our brilliant panelists? Please.
Good evening, everyone. Thank you so much. The panelists are really brilliant. They've given brilliant ideas, and it's an honor for me to be here. I'm a representative of young people. A few months ago, I would have called myself a child, but I'm now 18. So, yes, thank you so much. But I hate being an adult. No offense, no offense. So, my name is Fode. I'm from Sierra Leone. My question is related to all of the panelists, but I think they can just give a very brief answer to it. Because one of the panelists mentioned, I think, Professor, you did mention about intergenerational equity. And I think one of the biggest crises we face for me is what I say, we lack intergenerational knowledge transfer. It's very hard to see adults speaking with children about their skills or what their technicality is or are. For example, you can just check within yourselves. If, for example, you are a doctor, do you talk to your child about your medical interventions? Do you practice? What if, for example, if you are in your house and then you yourself, you got an heart attack? Did you ever talk to your child about how do you help someone that is having an heart attack? So if that's possibility, your child can help you in that moment. So this is a situation that we practically are facing globally, but mostly from an African perspective, we lack that. I can give a very clear example. In my country specifically, the recent government is having a lot of young people that are ministers, a lot of them below 35 years, and you know they are underperforming because why? When the knowledge of previous leaders were not transferred to them, and they have weak skills, and of course, because they are young, they have less experience, and because they did not have people back then who were teaching them and transferring those knowledge to them. So, of course, you see that gap. So I want to know what, obviously, the panelists are doing personally with their professional lives about, of course, how they transfer knowledge. I know Save the Children, Madam Inga, I know you do that on a professional basis, but I also want to know if you do that personally. So all of you. So both personally and professionally. Thank you.
Yeah, it's on now. It's interesting because what you said reminds me a lot of indigenous ways and values. It's not just intergenerational equity, but the knowledge transfer, not just the knowledge transfer, but the transfer of values and of mindsets and of worldviews. And that, I think, in modern life has been totally disrupted. So my children, I think they find more legitimacy in the internet than in myself. So, which is different from my generation and our parents, I think. But I mean, the one thing I tried myself to instill in my children is belonging to planet Earth rather than to one community or even one country or one culture. So I think it's really important to put that value of collectivism, that we belong to a bigger whole. And that we learn also from indigenous peoples, but we've lost it. This is the sort of the tail end of the Industrial Revolution, where we've put the last nail in the coffin by promoting individualism and reducing the whole importance of avoiding negative externalities unless it's breaking the law and you'd go to jail. But people don't think twice anymore. If I do this, will it harm that person? If it does, it's okay. It's not illegal. So yeah, let me do it. So I think some of these things would have been taken care of if that intergenerational transfer of insights had worked well, and now it's time to fix it individually and collectively. I think there's a burden on the education system also with this, in addition to parents, because parents have such a huge set of challenges to deal with in intergenerational communication, because you have so much distraction and so many forces running against you from all directions. So it's spot on. It's really a big challenge and really important to fix. Thank you for raising it.
Would anybody else want to answer?
So thank you. I think that's an excellent question. And yes, as Save the Children, we do that. That's part of our MO to ensure that children have access to information so that they can navigate. But one thing that I just, from a personal perspective, I am extremely privileged because I live in a safe country where I can have conversations with my children about values, where I can talk about being global citizens, etc. I am concerned about all these adults that live in fragile states, in vulnerable situations, because we meet a lot of adults that are traumatized and not capable of providing that support. So yes, we need to have knowledge transfer and sharing, but we also need to support parents to be able to do that. So that is the one thing. That's not necessarily an answer to your question, but maybe widening the challenge. But I do think that's really important, because we work a lot with refugees, and many of the parents that I've met are absolutely not capable when they are in trauma themselves to be the parents that their children need.
Thank you, Inger. So with that, I think we can have our closing remarks. Dirk Meyer, Head of Directorate General for Multilateral Development Policy Transformation and Climate, BMZ. Over to you, Dirk.
Very short. Thank you very much. I apologize for being late. We had the four funds, the big funds, together with a joint declaration on working much more together. And I was a panelist there, and that was really a historical moment where they are looking for comprehensive ways to work much more together. So I just react to one or two things I grasped. That I'm very much fond of bringing the health topic to the COP. I don't have to explain that to most of us here on the panel, because I worked for several years on global health and in the BMZ, and there we always tried to bring them together. So it's great that the COP put it on the agenda. I think we see two things. The one is that the awareness for climate change and all the efforts we have to undertake has a lot to do with ourselves, because in a damaged Earth will infect all of us, and there is no way out of it. The last years showed that. Maybe some rich people thought over the last decades, well, there will always be places that are fine for us, but this won't be the case. So the question of a livable planet is a question to all of us, and that helps to raise also much more awareness for the efforts we have to take for the next future. Then, by putting it on the agenda, we see that the health system itself has something to do when it comes to mitigation. So it's a job for ourselves, I would say, which is great too, to have that in mind. And the topic reminds us of another thing the professor just mentioned, what he takes with him, long-termism. That sometimes drove me crazy when I think that for decades we were all sure that access to universal healthcare systems is crucial for any kind of resilience. And now we discover it as new knowledge again, which is very, very mad and insane in a way. But nevertheless, as Marie-Ange, always optimistic, said, we have the solutions. And that's also what I think. We have the solutions. You are very, very right in that. So we shouldn't look too much on the bad figures. We should look on our own forces, on our own ambitions, on our own motivation. And although the audience now is smaller at this time of the day, it was great to have it on the agenda, and it's now up to us to continue with the work on that. So that's what I grasped when I came in here and still felt the energy on the panel. Thank you very much.
Thank you, Dirk. And with that, I thank you all. Over to Patricia. Are there any final words? She's saying no. Brilliant. Then a lovely end to this day, and may you enjoy the rest of the COP.
Welcome to the German Climate Pavilion at COP28 in Dubai. Ambitious, just together.